connected. I'm Listening is a 24/7, 365 initiative that works to do our part to end the stigma of talking about mental health. If you want to join the conversation, you can tweet us at #I'mListening. We're going to be taking your tweets all night, as well as talking with Dr. Jen Wider, our medical health expert, about new stats and facts. And then later we'll be joined by Dr. D. Jaffe, an addiction specialist, to talk about ways that we can get our self-soothing and coping mechanisms still engaged while self-isolating and social distancing. It's very, very important. We're here because the news is moving very fast, and heightened anxiety. People are starting to encounter depression and loneliness, and we really want people to get the facts and information they need, but more importantly, provide resources and let people know that we are here and we are listening. So we're going to listen for a moment to Mike Shinoda from Lincoln Park, who's going to talk a little bit about the importance of addressing mental health.
One thing that I've learned is that mental health, it's not a state of being. Think about it like something where you've got a scale of like, how are you doing right now? And so there's an awareness. Mental health is all about being aware of how am I doing today? Like if you say on a scale of 1 to 10, how healthy are you? And that's your state of mind. It's kind of like you don't ever want to dip below a certain level. So if you think about like, what is my mental health right now, and it feels like it's low, or you're looking at your spouse or friend or whoever, and you say, I think that they're having a really bad day, or they're having a really bad time. It should be cause for concern. It should be cause for.
All right.
One thing that I've learned,
really important message. Right now, more than ever, we need to be looking out for ourselves, but also those around us. And the way we do that is by contact and checking in. Why? Because by nature, humans are social beings. We are born in relationship, we grow in relationship, and our brains are literally social organs. It's imperative now, but also evolutionarily, that we stay connected to others. That is part of mental health. Now, our central nervous system mandates that we have a lot of connection. The way we feel most connected is eye contact, touch, and time together. But due to circumstances which are happening right now, we're not able to get all of our needs met. And so we have to find alternative ways of doing so. Voice and sight is going to be right now your best friend for you to work on your mental health. A lot of individuals are slowly starting to drop into anxiety and depression. And that's why we use this word co-regulation. And what that means is sometimes we don't have the capacity on our own to deal with all that's coming at us from the outside. But what's beautiful about our brains and our bodies is that we can utilize other individuals in our lives as a resource to help us maintain our mental health. So now more than ever, we need to be checking in on others and staying connected. Again, using technology to soothe ourselves and other individuals via making eye contact and also hearing their voices. So please, please, please take advantage of that. I want people to be reaching out to each other. It's imperative, especially as the news continues to move fast and to really, really, really spike our anxiety. Again, if you want to join the conversation, you can do so by tweeting at #I'mListening. We're going to be talking next about some important information that's coming in as we look at the facts around the world. We're going to be joined by Dr. Jen Wider, who's going to be talking to us about some new information as the pandemic continues. Dr. Jen Wider, how are you?
Hi, Dr. Chris. How are you?
I'm great. Thank you for joining us again.
Thanks for having me again.
Absolutely. So I wanted to have you walk us through a stat that I just got today, which is that U.S. cases of the COVID-19 have soared by more than 40% in just the past 24 hours.
So, this kind of statistic sounds very scary to people, but really what it represents, Chris, is the fact that we have more diagnostic testing going on in the widespread community. So in the past, initially when this first started here, we weren't really testing. It was difficult for people to get a test. They were calling their healthcare provider, they were going to emergency departments, and they were being turned away if they didn't meet a stringent criteria. Now we have more diagnostic testing going on. And as a result, Chris, the numbers are going to go up. And it shouldn't really cause a panic in people. We should just recognize that the reason for this is simply that there are more people being diagnosed.
Okay, that's good to hear, because I think when numbers like that come out, if we don't really dig deep to better understand where that's coming from, that can really make a lot of people uncomfortable. Talk to us about the other fact. I also read that they're saying that it's possible that the pandemic could last as long as 18 months or longer.
I think this is another thing. There is a tremendous amount of news that's very sensational and very fear mongering at this point. And I think this is not the kind of disease or virus that is just going to disappear. That's not how this is going to end. This virus is going to be around for a long time. And many medical experts that I spoke to think that this disease will fold in with the flu vaccine. So, for example, when we get vaccinated during the flu season, coronavirus or COVID-19 will be one of the strains of coronavirus that we are vaccinated against. So this is not a situation that is miraculously going to disappear. And that's what that 18-month number looks like. That's where it came from. And I think, the medical community also wants to impress upon people that this isn't going to be, 1 week and we're all back to school either. And it's very important to recognize that these social distancing measures will pay off if the majority of the country listens to them. It will slow down the spikes of numbers that go into our emergency rooms, that go into the hospitals that needed to be treated all at once, because that's what we saw with Italy, right? We saw that the Italian medical system really got crushed because so many people entered at once. It wasn't that, it wasn't that more people were infected than will be in the United States. It's that everyone was infected all at once. By slowing things down, the medical system will be able to function appropriately and to be able to respond well to people that are sick. And that's why social distancing is really important. But there will be an endpoint to this, Chris, and we spoke about that a little bit last night. Hopefully, in the meantime, while we are social distancing and while we are maintaining, our lives and our homes and starting new routines, there are measures globally to look for therapeutics, to look for a cure for this, for something that will treat it. Not necessarily a cure, of course, but something like a Tamiflu or a antiviral medication that will treat this. And that's really going to change the face of this, right? We're not all worried about getting influenza, even though it can be deadly, because we do have a treatment for it. We do have antivirals that can work against influenza A and B. And that's what we're hoping to see in the next couple of weeks to the next couple of months, something that is effective. And in that way, Chris, there are a lot of, global efforts right now in the therapeutic category that will make our lives go back to a semblance of normal. We're not going to be in a cave for 18 months. I just don't think that's realistic.
Okay, so you mentioned a word that's a hot button topic right now. You mentioned social distancing. I've been talking to nauseam about people, the importance of this, because as we keep saying, we're trying to flatten the curve. And the whole purpose of social distancing is not just to protect ourselves, but more importantly, to protect those around us and the most vulnerable. Now, I was looking at some news reports and my heart was broken when I was seeing what was going on down in Florida with spring break. So, Dr. Jen, for those that are still not quite getting it, can you give them a little pep talk? Because it sounds like it's still needed. Talk a little bit more about the social distancing and what's going on at spring break.
All right. So, this is such a good point, Chris. And I think this is one of these issues that is a generational issue. And there was a Wall Street Journal editorial on this, on how the COVID-19 really is a generational war, right? We have people in Gen X and older generations, and even a little younger than that, paying close attention, who have aging parents, who may have children, that sort of understand the social distancing idea. And then, of course, you have these college kids that have an invincibility complex to begin with. And I've done media all about this generation that, put the GoPro on their head and slide down a glacier and, break bones because they're looking for, that fast fix, essentially. The issue with that is that's the war that we're fighting right here. I saw the reports too and saw the women and men that were saying, hey, I'm not going to get it and I'm not ruining my spring break over it. And that's the problem. If we tout this as a disease of only elderly people, and believe me, I have aging parents, I have many friends who have beloved grandparents, many of us get the message, but what these kids and people in the millennial generation and a little bit younger, and I don't want to, say anything negative about people in these generations that are taking this seriously, but for the younger kids with the invincibility complex, this is really a societal effort that we need to maintain. And it's not just for elderly people or people that are immunocompromised. This is for everyone. This is for their parents. These are for people that are going into hospitals that need to have, that have a myocardial infarction that may not have anything to do with COVID-19, that need to have the hospitals functioning for everybody in our society. So the pep talk coming from me is we need to pay attention to this. We need to understand that there will be another spring break next year. There was a funny meme that I posted that, our grandparents were called to war and we're being asked to sit on our couch and we can all do it. It's true. We need to do it, Chris, like for the betterment of our society, but not just for, older people, if that's not what this generation is paying attention to. It's so our hospitals can run effectively for everybody, for pregnant women having babies, for people that are hospitalized for reasons that have nothing to do with coronavirus. Our hospitals, we don't want to see them overwhelmed in the way they were in Italy. And that's really why we're pushing social distancing in the medical community.
Okay, and we're going to keep talking about that. You're watching I'm Listening, Stay Connected, and we're providing you facts and resources. If you want to join the conversation, you can do so at hashtag I'm Listening. We're talking with Dr. Jen Weider. Jen, I have a tweet that I'd like you to discuss with me. The tweet is, I saw a video from China with teams sanitizing an entire city, which makes me think this virus is airborne. Is it even safe to go outside right now, even just for a walk?
So this has been a very large debate actually, Chris. So viruses can either be airborne or they can be transmitted through respiratory droplets. And so airborne virus would be standing in a room, walking by somebody who breathes, and you can then breathe it in, which is why those N95 masks were being touted as defense against this. The N95 describes the pore size of the mask, the little circle that allows virus particles to get in. N95 respirator masks are one of the smallest on the market. They were used for TB, and they continue to be used for TB. Respiratory droplets basically mean that you sneeze or cough, and the virus particle, gets alongside the sneeze or the cough and then lands somewhere, either lands on someone's face, lands on a surface like a doorknob. You hold the doorknob and wipe your face, and then you get the disease. It is safe to go outside right now. I read a CDC briefing this morning and yesterday. There's a large population of people studying this disease that believe it's respiratory droplet transferred. It is not floating around in thin air outside. It is safe to go outside. It's wise to go outside. I would recommend still social distancing outside. In my town, people are walking their dogs and maintaining 6 feet from each other. I think that's really, really the responsible thing to do. But if you go outside, you walk your dog, you take a jog, no one is around, you are completely safe. And remember, like when you're going into grocery stores and stuff like that, I recommend wearing gloves because these virus particles can be on foodstuffs, food items. You're not aware of what they're on. You could buy a box of pasta. Handle it with a glove and then wipe it down with a wipe if you can. And that would be for, extreme measures of caution. But we can take precautions, but we can absolutely be outside and not worry that it's just floating around. Beautiful.
And I keep saying that to people I'm working with clinically as well, that just for our own mental health, it's imperative that we're moving our body, we're getting fresh air, we're getting sunlight, we're changing up our routine. So thank you so much, Dr. Jen. Have a great night.
Thanks so much, Dr. Chris.
All right, we have another tweet. The tweet asks, this is embarrassing, but I watched one of those virus movies on Netflix with my boyfriend, and now I'm in constant state of panic. I'm pretty much living in fear that the world might turn out just like the movie. How do I get out of this mentality? Now, listen, everybody. I'm telling people, please don't watch these movies. Why? Because they're an over-dramatized, catastrophized version of what's possible. This is just putting people into a panic state. More than ever, we need to be watching movies that are making us laugh, that are making us feel soothed and grounded. Again, our body is such a powerful barometer of our mental health. If you are feeling tense and you are feeling unsure, if you are not feeling safe, it is not the time to be watching things that further push you toward that. It's quite the opposite. I want people to be having conversations, listening to music, and watching movies that make them laugh and find some joy. Because again, we're taking this all very seriously. But mental health mandates that we take time away from things that are making us feel anxious or depressed. Now, I want to switch topics and talk about the fact that for a lot of individuals, they don't have access right now to the important coping mechanisms that help them stay safe, but more importantly, help them with some of their acts of sobriety, whether it's with their eating, whether it's with drugs and alcohol. A lot of individuals rely upon 12-step meetings, access to therapy sessions, and even going to the gym. So while some of us are stuck at home, home, we're having to get a little creative and find new ways of getting our coping mechanisms met. We're going to talk with Dr. Adi Jaffe, an addiction specialist, to talk about other ways to address this. Dr. Adi Jaffe, how are you?
I'm great, man. So good to see you. So happy you guys are doing this.
Yeah, we're working really hard here to give people access to some resources. Now, one of the things that's coming into my office, I'm doing phone sessions, I'm doing Skype sessions, because again, social distancing, is people are saying I don't have access to some of the resources I used to have. So what kinds of things are you talking to people about?
So first of all, it's funny, but I'm doing the same thing you're doing. I'm offering more lives, more resources, more virtual ways of letting people access help. One of the things we have actually done, and we created a special link for your people if any of them want to join, is we've opened up for free, at least for the next 2 weeks, our online support groups.
Beautiful.
So we currently have 4 of those a week, and exactly for the reasons that you just pointed out. People are used to going places. They're not allowed to do that anymore, but what are they going to do in the meantime? So I created a link, especially for anybody listening to this. It's a bit.ly link, just bit.ly.com/Dr. J. K-Rock, all caps. And if you go there, you can get 2 weeks of free support. I'm hoping this doesn't last for more than 2 weeks to a month, but I want to give people a way to tune in. So we went on Facebook Live today, et cetera. But I think what you said is so important for people to understand. This is serious. We have to do what we can to protect ourselves and society at large. But we also have to take care of ourselves, because if we don't take care of ourselves, we can end up with problems that exacerbate our underlying conditions for years or even decades.
Yeah. So for those that are at home and they're talking a lot about overconsumption, I'm hearing people talk about getting, over intoxicated and not really setting any boundaries around their consumptions of food and sugar. What resources or tips would you give them, or even just a perspective to have? Should they be letting go of some of those boundaries? Should they be tightening them at a time right now? What should they be doing?
That's a good question. I think you're right. I've heard about people actually having drinking open bar parties online. Right, so drinking with other people virtually. I think I want to hit this from 2 different directions. First of all, I think you should take it a little easy on yourself and recognize that this is an incredibly stressful time. And so you may drink. You're also at home more than you typically are. And so you may end up drinking a little bit more than you normally do. But this to me represents an opportunity to figure out what are your support resources. How can you plug in, even if you can't go to a friend's house? Can you FaceTime? Can you get on a chat? Can you get a group together so you get to socialize? And I heard you talking before I came on with you. I really look at this as an opportunity to use the same self-help, growth, educational resources that maybe you've said you don't have the time to do, and create a schedule for yourself to benefit from those. Because boredom is absolutely one of those things that you will fill up with smoking weed or drinking.
Yeah, and that's what I'm seeing myself do. Before I was like, I'm so busy, I struggle to get in my self-care. Well, guess what? Now I have all the time in the world, so I'm finally getting that meditation routine down. I'm settling myself down and taking baths. And what's really been powerful is when we finally sit still, we get to encounter some of the most important parts of ourselves that we usually distract away from, right?
So true, so true. And again, I think we have to listen to ourselves a little bit, right? If we're finding ourselves in a time where we have the most freedom we've had in terms of actual flexibility and scheduling that we've had, I would argue for most of us our entire lives, and we're still not finding the time to do those things we've said we wanted to do for so long, it might not be about time. And that's okay. You don't have to judge yourself for that. But how do you introduce some of those things? This is the time to go online and take that online class you want to take. This is exactly the moment where that book that you've had sitting on your shelf for 3 years and you've wanted to read is calling out for you. So how do you find the time to do that? And you said this, so I want to repeat it. I heard it right before I came on. Don't make the mistake of making every waking moment you have right now studying what's happening with Corona and what the world implications are for years or decades. I see so many people that are just so obsessed with it. I don't have a hard time understanding why they want to drink the entire time.
And that's what I'm saying to people. Also, just set some boundaries with the conversations you're letting people pull you into, right? Because it's about your conversations with yourself, but also the ones with others.
Yeah, I think that's true all the time in life. It's just that right now, it's this there's this incredible focal topic that is on everybody's lips. And again, as we pointed out, people are isolated. So this is that time. I was talking to my clients, and actually on one of my live chats that I'd mentioned before, and I said, in life, oftentimes we get the false impression that being strong and rigid is the thing that gets you through. But I have a tree outside of my window, and if you study engineering and bridges in nature and in human structures, it's actually flexibility and adaptability that's going to get you to the other side.
Beautiful.
So your life structure is not going to look the way you're used to for the next couple of weeks, maybe month or so. That's okay. How do you adapt in a way that takes care of yourself and the people around you instead of trying to figure out how to hold on to your way of life for dear life?
Yeah, let some things change. I have a tweet that I want you to answer with us. The tweet was, I stocked up on a bunch of non-perishables at the store, and while I'm stuck at home, I can't stop snacking on all of them out of boredom, which is giving me anxiety because I'm not being active, which can lead to stress eating, and I wind up eating more. How can I break this new habit?
That's so important. So a couple of things that I've said to people. First of all, it depends on what municipality you live in right now. So please take what I'm about to say with not with a grain of salt, but with an eye towards what you are and you're not allowed to do. In LA, for instance, we're not on lockdown. I urge people to, stock those non-perishables so that if you have a need long term, you can have that food. But eat the healthy stuff right now. Have a banana and have some fruit, and eat the things that are going to go bad first. Also, drink a ton of water. Your body is flooding itself with hormones right now, stress hormones, things like adrenaline, things like cortisol. And in order for your kidneys and your liver to work efficiently, you have to be able to flush that stuff out. And so you need water in your system. Take care of the machine so it can better take care of you. And then because we're not on lockdown here, I do go for walks around. Just to be clear, nobody is around my block. It's literally like a ghost town. But I went for a walk this morning because I need to be outside. I need for my body to still have activity. If you are in lockdown mode, how lucky are we that we live in an age where you can go on YouTube or any one of dozens and dozens of apps, or people are doing this on Instagram. One of my friends held a public free yoga class on her Instagram Live yesterday.
Love it.
Don't mistake being stuck at home with being unable to be active. They're not the same thing. There are a lot of things that you can do at home to keep that activity low. Because I think the person on Twitter is right. In the absence of activity, in the absence of interest, in the absence of things to do, you will look for ways to fill that void. And eating, drinking, smoking weed, watching porn, those are all examples of ways to fill that void.
Beautiful. Dr. Geographic, thank you so much. Have a great night.
Thank you. Thanks for having this. Have a great night, man.
Beautiful. So, again, take advantage of all the resources. I'm so proud and thankful to see all the different people that are giving you access to cooking lessons, knitting lessons, yoga, concerts, free tours of museums. So there's no reason to not fill your day and, more importantly, your mind with things that are soothing and kind of distracting from all the stress that's happening around us. So we have another Twitter. If you want to join the conversation, you can do so by tweeting at #I'mListening. We're here for you. We're trying to give you facts and resources, but more importantly, we're trying to remind you to really focus on your mental health and also to let you know that we're here with you and for you. This question says, is it okay to bring my kids to their grandparents' house? I'm concerned about both my kids and parents' safety. I'm telling people to please not congregate. I know that the CDC and the government keep giving different numbers, but again, it's imperative that we're honoring social distancing and 6 feet apart from each other. And so now's not the time to physically try to connect with individuals. I think it's possible that you reach out via things like FaceTime so you can still connect and stay close, but no, please don't be visiting each other. All right, we have a phone call. We have Alex from Canoga Park on the line. Alex, how are you?
I'm good. How are you?
I'm well. How are you doing?
I'm good. Thank you for taking the time to answer our questions.
Absolutely. What can I help you with?
So I feel like I'm a very empathic person, and I'm feeling overwhelmed with everything that's happening on social media. I just keep getting bashed with all this information. And I'm just wondering, how do you think I should be dealing with the anxiety that I'm getting from how our society is dealing with the outbreak?
Yeah, it's a beautiful question. You know, not everyone in our society is managing their anxiety really well, and they're passing along to everyone else. So I'm talking a lot about boundaries. I want people to, again, check in with their own mental health. And if you're feeling as though you're hitting a limit of stress beyond what's making you feel safe and comfortable, it's time to put your phone down. It's time to limit your access to things. I'm also telling people, just because someone gets you on the phone doesn't mean you have to have the conversation they're looking to have, because a lot of people are just flooding each other with their own anxiety. So again, put your phone down and really limit your exposure to that. And please try to do some fun stuff, because that's what our nervous systems need. And again, that's also what's going to help really boost our immune system.
Yeah. Okay. Thank you so much for answering my question.
Great. Have a beautiful night.
You too. Thank you so much. Appreciate you.
Of course. Again, you're watching I'm Listening. Stay connected. I'm Listening is part of an initiative, 24/7, 365. We're working to end the stigma about talking about mental health. Again, now more than ever, we need to get vulnerable, transparent, and share with those around us how we're feeling, and they can share back how they're feeling. We have a tweet. If you want to join the conversation, you're tweeting at hashtag I'm Listening. We're answering your questions. The next tweet asks, I'm temporarily laid off from my job, and no one seems to be hiring right now, so my stress and depression are out of control. I'm afraid I won't be able to afford essentials if things get worse. Any advice? Yeah, my heart goes out to you, and I empathize with that. I myself am watching those around me losing their jobs and getting laid off. But I want to remind you that there are a lot of service industry jobs that are actually hiring now because they're overwhelmed with the demand. So reach out to some of the local pharmacies and supermarkets, because I've seen posts where they're looking for individuals to hire, as well as some of these rideshare services. Although they're limiting the ability for people to actually share the rides, they are giving individual rides. So that's something you can look into as well, because people are still needing transport. So please reach out to those different individuals, because it's imperative that we are still working and getting our essential needs met. We have one final tweet. This one asks, my roommate's sister recently tested positive for COVID-19. She isn't doing well. My roommate's hurting so much right now because she fears for her sister's life and she can't even see her. How can I help make her feel more at ease during this tragic time? It's heartbreaking to hear things like that. And a lot of us aren't feeling really equipped to help others really self-soothe. Right now, the best thing you can do is just be there for her. When we're going through difficult times, it's important that we know that we're not alone in things, and also that we have someone we can reach out to just talk about how we're feeling. And that's the best you can offer right now. It's a really terrible time. But again, your mere presence is what's going to help this person from not feeling alone and dropping into some depression, loneliness, and again, further impacting their anxiety. So please, people, know that we want to keep reaching out on those around us and checking in. I've been doing that all day long, reaching out to family members and friends, just saying to them, hey, I'm here, I'm listening. If you need to talk, reach out to me. We have a phone call. We have Jared on the line from San Francisco. Jared, welcome to I'm Listening, Stay Connected. How are you?
I'm doing really well. Thank you. Thank you for asking.
How's it going?
I'm actually calling because I recently just got let go from my job because of the coronavirus, and I'm like trying my best, trying to stay sane, and it's honestly really hard to like kind of stay positive in like these moments. And I just wanted to, I guess, ask you like what are like some good like tips or whatnot just to kind of stay sane and positive in these like tough times.
Yeah, a couple of things I'm reminding people is that the difficulties that are happening, they're new for us, and that can be scary, but this isn't going to be forever. But I want people to feel their feelings. I don't want the advice to be distract, don't feel, get yourself out of it. It's really imperative that we allow ourselves to kind of drop into it. So I want you to first kind of go through the mourning process. There's a mourning process of the loss of our job, because a lot of us have our identity tied to our job. That's what our day consists of, is getting up and going to work. And now we're looking at our day and our week, and there's really nothing ahead. And so for someone like you, I'd say a couple of things. Number one, plan a structure. I still want you to get up and do something. I tell people, get up, get washed, get dressed, change. You don't want to just have what we call time creep, where the day just endlessly goes on and you're just floating through the day. That will absolutely cause you some depression. Also, stay busy, find things to do with your time. So I do want you to find some activities that are going to give you a little bit of a break from sitting in that stress of what's going to happen next. And finally, use the time the best way you can. Like Dr. D was saying, now's the time to read some of those books. Now's the time to take some of those courses and classes and learn some new hobbies. So find some value in your day, because otherwise it's going to be really hard to get up in the morning, and it's going to add to more layers of depression and anxiety. So focus on that. And again, I empathize with what's going on, but this isn't going to be forever. So thank you so much for your call.
Thank you. Thank you so much.
Absolutely.
Bye, guys.
Listen, a lot of us are doing the best we can. And so nothing's going to be perfect. Nothing's going to be ideal. But what we're really trying to do is find normalcy as much as possible. And so I'm really advocating for everyone to just find structure. We're all in this together, and we're doing the best we can. I'm listening. Stay connected. We have some resources for you. We're going to share those with you at the end of the show. And this Monday night, we'll be back at 5 p.m. Pacific Standard Time. That's 8 p.m. Eastern. And we're going to be talking with an epidemiologist to better understand what we're looking at and for how long might we be in some of these issues and struggles, and get some more facts and figures. But again, tweet any questions you have at #I'mListening, because again, we are here and we are listening. Thank you for joining us. Again, we're going to close out with some resources for those that feel like they need some extra care and support. Thank you for joining us, and you all take care, and please, please be well.